Welcome, Dr. Porche.
Thank you. Hi.
I'm so glad to have Dr. Lea Porche with Eastern Virginia Medical School, an assistant professor in the Department of Maternal Fetal Health, to talk to us today a little bit about the coronavirus from the perspective of a medical doctor and one who is, a specialist in maternal fetal medicine. So, for our first question, Dr. Porche, will you tell us in simple layman terms about the mRNA procedure used to make the COVID vaccines and how they could be developed so quickly?
Yeah, so with mRNA vaccines, the way that they work is they present your body the code for a viral protein. It is not the virus, it is not live virus. It's actually not even a piece of the virus. It shows your body what the protein structure looks like so that your body can then make antibodies against that. And so whenever you, if you were to ever come in contact with the virus, you now have these antibodies already and know exactly what to do to get rid of the virus or neutralize the threat. And so that's how the mRNA virus vaccines work. And they allow your body to make these antibodies. You've already got them ready, and you don't have to have an actual infection to be able to create them.
Okay, so some people have questions about how stem cells were used in the development of these. Can you talk a little bit about that?
Yeah, so stem cells have been used in the development of the vaccine in the sense that when it was being tested, those cells were able to confirm that one, that the vaccine was useful and that it worked, and two, that it was safe in human cells. And so those are two things that, of course, you want to be established before there's a medication that you're taking. Now, the stem cells were used in the development of the vaccine. They are not used in making the vaccine. So once it was developed and it was proven in those studies that it was safe, they have other ways to actually manufacture the vaccine. And so stem cells are not used in the vaccine that is administered to patients. And they're actually in the Pfizer and Moderna ones, they were not used. There may be part of the process with the Johnson and Johnson, but the two kind of primary ones that are most widely distributed do not actually use stem cells in the production of the vaccine.
Okay, terrific. Thanks. Thanks a lot. Now, as a specialist in maternal fetal medicine, would you talk a little bit about COVID and pregnancy? What do pregnant women do to stay safe during this prolonged COVID epidemic?
Absolutely. So we have been seeing these kind of rises and falls in the number of COVID cases in the community. We know that these things come seasonally and as people are in close contact with each other. And then now, of course, more recently with the new variants that are coming out, like the Delta variant. We have seen, and there have been studies done on many people, including, well, there have been observational studies that included pregnant women who have shown that these vaccines are safe in pregnancy. They don't cause any increased risks to a patient that's pregnant versus someone who's non-pregnant. And they're very effective at protecting patients against COVID, either getting the virus or having severe disease from the virus. So we have seen that this vaccine is very helpful in preventing disease and death from COVID-19. Now, with pregnant patients, especially if you have any other high-risk conditions like obesity or chronic hypertension or asthma, just pregnancy by itself increases your risk of having severe disease from any respiratory issue, flu, and especially COVID-19. Now, we are encouraging all of our pregnant patients, all of our patients in general, but definitely all of our pregnant patients, that they should get vaccinated. The studies have shown that it decreases your hospitalization, decreases the risk of getting intubated or having a breathing tube down your throat because of COVID. And so it's definitely recommended that our patients are getting vaccinated. Now, in the meantime, we're asking people wash your hands, wear your mask whenever you're out, especially whenever you're indoors. Maintain social distancing when you're able to do so, and especially try to avoid any situations where you may be in close contact with someone that you know has coronavirus, and limiting those interactions. The difficulty is that we don't know always when someone has it, right? They talk about this asymptomatic spread or spread of the virus without having symptoms. So that makes even going to the grocery store can be a high risk activity. Going to Target, we all love to go to Target. Going out can be, you have an unknown risk of exposure. So definitely wearing your mask, cleaning your hands, and whenever you're able, get the COVID-19 vaccine.
Yeah, I'm especially concerned for people who suffer health disparities already, and during this COVID epidemic, and now the resurgence with the Delta and the Lambda variants. Women of color, I think, especially should be getting that vaccine. Do you agree? And how do you have that conversation?
Absolutely. And so we know that COVID-19 has, like many other disease processes, has disproportionately affected populations of color, Black and brown people, and that includes our pregnant patients. And so I'm definitely discussing with my patients, encouraging them to get the COVID-19 vaccine to protect them, because in addition to being pregnant, especially if they are women of color, they have that increased risk factor. And so I'm definitely encouraging patients to get the vaccine. Now, I do have a lot of patients who are wary of vaccines or of just the healthcare system. They're wary of how quickly the vaccine was developed. And I have a couple of things that I discussed with them regarding those issues. With regards to how quickly the vaccine was developed, I think about it like this. Vaccine technology has been around for many, many, many years, right? We don't hear a lot about polio anymore because people got vaccinated and we really got rid of that. We hear very little about measles because people are vaccinated and it protects our whole community from these things. So a lot of the technology regarding vaccines has already been developed. And I think about it as, okay, say you know how to make an apple pie. I know how to make an apple pie. I've been making apple pies for years and years and years. Now I need to make a cherry pie. You know, it's a little bit different, but I know how to make a pie. And so this is how I explain that we are able to have these new vaccines that are developed efficiently so that they can actually be useful. Now, when it comes to addressing the hesitance of Black and brown people to getting vaccines or getting new things in the medical community, first of all, I have to say, I get it. I understand, right? There have been times in our history, and unfortunately, it was not just once, it's been time and time again, where people who are of color, who were valued as less in our community, were experimented on. Now, what I will say about this circumstance is, one, we are coming into a new age. The vaccine was studied in all populations. It was not just Black and brown people, but that was actually the minority of the people who were studied for the vaccine trials. And we also know that it's effective. And if you think about access to vaccines, we think about who it's available to. It's available to all communities. And I think that you can see who is partaking and how it has been safe in these populations. And so one thing that we don't want to do is opt out of something that's really going to be helpful for us. Not only is COVID a terrible disease, but it affects us more. So in that sense, I think that we need to really be proactive about protecting ourselves, protecting our families, protecting our children, um, and and get the vaccine because it's available, it's safe, and it's been proven to be so.
Super. Well, this whole session was titled, coping with COVID, mind, body, and soul. And I think you've certainly given us a lot to think of in terms of our bodies. Definitely, we need to take care of ourselves. We need to take the vaccine, wear our masks, take this whole new variant seriously,
Absolutely.
and especially if
And
at higher risk. Go ahead.
absolutely. And what they're finding now is that this new surge of cases are mostly in the unvaccinated population. So the Delta variant is really, really ravaging the population of patients who have not been vaccinated. And this is the one that is, a higher viral load and easier to transmit and easier to catch. And so if we can, vaccinate all those who have not been vaccinated, maybe we can squash this and we won't have these continued go through the Greek alphabet of all these different variants that become worse and worse and scarier and scarier. So definitely, whenever you have the chance, seek out, go find it, go get the vaccine.
So I'm going to ask you one quick question.
Yeah.
I'm vaccinated, my family's vaccinated, but we're all really aware of the fact that we still can get COVID asymptomatically and we can spread COVID without even knowing it. My biggest concern is spreading it to my grandchildren who are under 12 and have not been vaccinated. Do you have any inside word on when we're going to be able to vaccinate our kids?
I don't have any insight on that. I am excited about it because I have young children and I would really like for them to be protected, not just trusting the adults around them to protect them, but also having that vaccination status for themselves. Now, I know that one thing that we can do, just like we do with the whooping cough vaccine and pregnancy, is really try to cocoon our children. So not just the pregnant moms are we asking to get vaccinated, but all the family members that are going to be around. And of course, it's going to protect everyone, but it's also another way to kind of to have a hedge of protection around our children until they can get vaccinated.
Yeah, good. Well, good advice. And we thank you for sharing your very valuable time with Eastern Shore Healthy Communities. And hopefully we can have you back again sometime. But thanks
That
so
sounds
much.
wonderful.
All
Thank
right.
you very much for having me. Have a wonderful day.
Thank you. Our pleasure.